Hello, everybody, and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin, and I'm always excited that you're here. But today, I'm excited for a very special guest, someone who just brings so much passion and greatness to dentistry that I'm excited to feature on the Patient First Podcast. Eileen Day, who is the founder and president of DSO Vendor Insights Network, DVIN. Eileen has a deep passion for making a difference. She combines her extensive experience in building sales teams and digital marketing with her unwavering commitment to driving change and love. I mean, we're both change agents and fostering collaboration, which we both do in the dental industry. It's just great to have you here. Eileen believes that by bridging the gap between DSOs and vendors and providing a space for open dialogue and meaningful partnerships, the dental industry can achieve new levels of growth, drive, and positive change. Thank you so much for being on the podcast.
Well, thank you for having me, Brian. I'm super excited to be here.
Yeah, I've only met you a couple times, but each time I just can tell you, like, you are a driver of positive change and have like in your bio, and just like you bring so much positive energy and commitment to what you do. So, I'd love to set the stage by first asking sort of how did you fall into this sort of what you're doing today?
Well, it's a funny peculiar story more than haha. I come from a different industry. People didn't know me. I was attracted to a company that was, trying to be a trailblazer itself as far as technology that it offered. And so I came out of, the industry that I came from, which was mostly digital marketing, automotive, digital transformation, and came into dentistry and quickly figured out, wow, I'm in a different world. I'm not in Kansas anymore. And so out of my need to understand the industry on a much more quick level than I was able to by myself, I thought, well, why don't I ask everybody else in this industry what they're experiencing as far as breaking into the DSO space? And so that's literally how DVIN got started. Was an idea to get together and let's talk about, selling to DSOs. And then the engineer in me started putting together topics and structures, and then I'm like, this is a real initiative, and let's have some things that align with those goals and initiatives and the mission to bridge the gap between DSOs and vendors, because that became quickly apparent was that disparage between DSOs and vendors, and whether it be a DSO not knowing what vendors and solutions are out there to a vendor not knowing how to, market themselves to a DSO, like what actually gets an audience of a DSO, because it's quite a different process. So we've got all sorts of initiatives that line up to those goals. And but it really literally started as me just wanting to collaborate with other vendors, and it's turned into something quite special, and we're going to be making some big changes in the industry, so we're excited about that.
Yeah, I agree. And you're already making big changes in the industry in a positive way. You know, I I've worked sort of my historically worked a lot with dentists, and there's a lot of dentists that listen to this podcast. And they might be wondering, like, what is the disconnect between vendors and DSOs? But and just like talk selling to dentists, I like to say uh, one of the worst jobs I can think of for me personally to have is selling something to a dentist and not being a dentist, right? Because they're like, they're like, you're not a dentist, you don't know, right? And I get that, and there's always going to be that sort of like disconnect between dentists. So between somebody who's a dentist and somebody who's a vendor selling to dentists, even if they're so knowledgeable about it, you don't have the practical experience. But that's a very different world. And for those, it almost feels like the DSO industry is very separate from, if you go to a DSO meeting versus a traditional like Greater New York or Midwinter meeting, is very different. So how would you say, what is the big disconnect between group practices, DSOs, and the vendors that are selling to them?
That is a great question, and it's one that's not answered really quickly. Some of it's self-inflicted by vendors, to be very frank. The traditional sales methods don't work in this industry because we're selling to a different persona, right? Like you said, selling to dentist is different than selling to someone else. How do you sell to a dentist without being a dentist? Isn't that what you said?
Yeah, it's hard, I think.
Yeah, that's hard to do. Putting yourself in their shoes. I've been in dentist office before, but I certainly have never been in the back, so I don't know how that works. So how do I know what's best for them as a vendor? All I know is I want to sell my product to them, correct? So
Mhm.
some of that has been self-inflicted in that the traditional sales methodologies don't work because dentist the client is different. It doesn't mean they're not good business people. It just means that they think differently about what is best for their organization or their practice. So we have to adjust that. And we are discovering the things that resonate most with dental practices and with DSOs in particular. And we're gathering that information, and then we're on our end, we're changing our mindset and how we approach them. We're meeting them where they want to be met. And so I saw that gap there between, vendors and the way they were approaching DSOs, and DSOs and the way they were, pushing back on the traditional sales methods. So we're working on that, changing the mindset, finding out what the DSOs want as far as preferences go, and then meeting them in the middle. But that's just approach, right? So
Mhm.
there's also solution. DSOs all have different issues depending on their infrastructure, depending on their own model. And there are a lot of different models of DSOs. So my solution may not necessarily be a good solution for every DSO out there. And so again, needing to get that collaboration fostered and talk about what as a DSO is ideal for you as a solution for this, for RCM or for marketing or for PMS or for integration, for a myriad of solutions out there. What is your ideal solution, and what's needed, and what do you need from vendors? And there's that so many conversations around that we're also aligning our initiatives towards by having a podcast, by being on panels, by having a website where DSOs can go and find vendors, but also match by their solution and not necessarily by the product, if you will. So, a lot of things have created the problems or the issues, but some of this is just from also the fact that this industry is in a state of consolidation, and it has been for quite some time, which again tends to slow down progress when it comes to technology, or when it comes to change management, or when it comes to even same store growth, which is that's a big buzzword right now. Consolidation can tend to slow that down because there's no standardization in within a DSO, right? So that's why you and I, we're talking so animated when we met a few weeks ago, because all of these things just tie into each other. And I feel we just need to find a way to all talk about it, unwrap the spaghetti or the ball of yarn, if you will, and put them together and give DSOs what they need. But we also extract from them what their preference is, what their model is, what is ideal for them, etc., and we match that. So that's been my vision, and hopefully that's going to come around sooner rather than later, so that the industry can move forward together.
Yeah, it's really interesting, because I've been thinking about sort of high level what's going on, from the books that I've written, and I frankly I didn't even make the connection myself until this week. In my first book, The Patient First Manifesto, I call the Great Disconnect, which is the disconnection between patients and dental professionals. I talk a lot about why that occurs, and which there's good reasons why that dentists don't look at dentistry the same way as patients, and kind of how to overcome that. My second book, Dental Disorder, I talk about a lot about disconnection in the industry between, all the systems, between the people, like even in your dental practice, you're having lunch with your team and they're probably sucked in their phone and they're not paying attention to you, right? And you have like a very special type of disconnection, which is between vendors and the organizations that they sell to. And I think it's kind of rampant, this sort of disconnection that's going on, right? And like you said, probably all of it is to some degree self-imposed, right? And also to some degree, like it's probably not that hard, frankly, to but it just requires a mindset shift of like, this is who I'm talking to. Let's look at it from their perspective, right? Not our perspective. And what's interesting about DSOs that I think is very different than sort of a general dental practice is like you said, each one is they're structured differently, they have different issues, and and a unifying theme that I'm hearing from you and DVIN and is really just like comes down to the basics of communication, which is listen. Do you agree?
Yes, absolutely. Absolutely. Someone, a couple of times I've heard it. A lot of times we listen to respond rather than listen to understand. And I believe we need to start doing, more listening to understand rather than just listening to respond to what someone's saying. And it's not just salespeople. It's, we just do it as humans, right? We want to have something good to contribute to a conversation. So sometimes we're only listening to respond versus actually understanding, and that's again shifting of a mindset. So I think that if we collectively do it, it's going to be more impactful. If we all group together and understand it together, I think that's going to help actually sink in as well. With this consolidation going on in this industry, like you said, the communication is all the way from the practice to the patient to the vendors to the DSOs. It's everywhere. The miscommunication and the need for listening and collaboration. And so it's a simple concept, but not so easy to change a mindset. So that's what I love about DVIN, and that's what I love about meeting everyone in this industry that really agrees. There's not anybody that disagrees. It's like, okay, there's the problem. How do we fix it?
Yeah. And we've been talking a lot more about DSOs on this podcast than historically, which is funny because I was used to be on the leadership team of one, right? but 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 I'm really understanding now the just the explosive velocity the increase in velocity in the aggregation of what's going on in the consolidation, like you said, in the industry, and how that's rapidly changing our industry. And I don't do that as a bad thing. Frankly, I think that there's a lot of positive aspects with that, but it certainly, I mean, like consolidation is like the end result of a lot of connection, right? And that's happening so rapidly. So even if you're an individual office right now, unless you're going to be excellent at both, if you're a clinical dentist alone in a practice or that you own, right? I believe that you're going to have to be exceptional at both clinical dentistry and at business to have that model going forward. And that they kind of fall outside of the DSO world a little bit, right? But for everybody else, which is probably 75%, maybe 80%, what you're doing is a key component that I feel like, because you can't have innovation if you have the best product in the world, you're solving the biggest problem in the world, and you don't know how to communicate it to the people that can actually apply it to make patients' lives better, right? And so, you know, I see you as providing an exceptional service that I didn't even know that was needed until we met. So, I mean, it's so very much appreciate what you're doing, and I mean, I kind of think that's probably why DVIN has taken off like it has, right? Because you're just solving such a massive need. Is that kind of how you see it too?
Yes, and it's solving a massive need, but it's also, kind of like I said, it's unwinding that spaghetti or that ball of yarn, because there are so many moving parts. You mentioned, there's the it at the end of the day, it boils down to the patient journey that's being provided, right? That's what all of us want to do at the end of the day. That at least should be our goal, right? Is whatever we do should be aligning with that one mission, is to improve the patient journey and promote oral health in the world. In the world, which is no easy task. That's huge. So I think to keep that always in the back of our minds, that that's the goal, is really really important, instead of just, I just need to sell my product, or I just need to sell it to this DSO, or I just need to make my goal. At the end of the day, if you sell your product, how is that going to help the patient journey? That's something that needs to be asked of all of us. And you can't you can't answer that question if you don't know how that DSO provides that to that patient. Because again, that's different. Whether, we were just on a post yesterday talking about telehealth, right?
Yeah.
That's a different audience. So the way they provide a better patient journey is going to be different than a DSO that serves a lot of underserved communities, or perhaps remote communities, or perhaps the elderly. The patient journey is different for all of them. So our solutions are literally important, that they tailor to whatever that need is that that DSO is fulfilling. So it's just so important to keep that continuum of care in mind when you're dealing with selling to a DSO, speaking to a DSO, and finding out what they need. You got to find out what their goals are as well, so that you can align with them. And there's nothing wrong with it not being a fit. You're not going to be a fit for every single person you meet, right? You're going to be a fit for the ones whose goals and whose problems and your solution lines up the best with their problems. So trying to do that has been, it's been challenging, but it's been, like you said, people have really latched on to the concept of, this really needs to be done. If that's what we want to do at the end of the day, is promote this industry and help the patient journey and promote oral health, we have to do that, or else it's not going to happen. But as vendors, we're the backbone of the industry. Without a PMS system, what are they going to do? Without x-rays, what are they going to do? Without, everything that we provide to the industry is provided by a vendor. And the vendors have to understand that's a monumental task, and we have to work together sometimes to present entire solutions to these DSOs, so that they can accomplish their goals. So I think that's why it's caught on, because everybody understands that we have a big job to do, and we need to step up to do it. And it historically hasn't been done yet, but it's that's all about to change. So we're excited.
Yeah, I just love the perspective that you bring. I want to highlight the vendors being the backbone of the industry, because I I talk to a lot of dentists, and dentists oftentimes view vendors as like just trying to sell them something. And there are those vendors out there doing that. And frankly, I don't see them around too long. Like the ones who are purely focused on just like, I'm in dentistry to just like exploit the industry. I don't see it. And I just did a podcast not that long ago where I talked about, it's been heartwarming for me to go to these DSO meetings and talk to non-dentists who are in the C-suite, or maybe a regional manager, who are just so passionate about patient care, and they're not in the line of care. And I see that like that. I think overarching is a complete myth that the people who aren't in the line of care aren't thinking about the patient care. In fact, probably the same percentage of people in the line of care aren't as aren't as focused as patient care as those ones who are. Maybe, I'm a little biased because I'm a clinician, right? But I do think that there's this, people would be shocked if the clinicians, that the people in the line of care, if they would go to a DSO meeting and like pretend like they're not in the line of care and talk to people, how many people are passionate about patient care. I think it's phenomenal. And you're right. I think vendors are the backbone of this industry, and they're certainly the ones that are driving innovation and improving things from to make tomorrow better than yesterday, and to improve the oral care of our the patients we serve, expanding care. And it's just another reason why, I mean, obviously why, and you are at the forefront of people who are keeping the patient in mind when you're doing this. So again, I just very much appreciate what you do, and I appreciate you being on the podcast. So, where can people find out more about you, about DVIN? Where should they go?
Well, so if you're a vendor, you can just go to our website, dsovin.com, and there's a form you can fill out if you want to become a vendor, or if you just want to be listed on the website, or anywhere in between. Just go to the website, and we'll take it from there. We're a fun group. We get together weekly and discuss different topics. We have DSOs come on our calls and tell us, we have Q&As where we're able to actually ask the DSOs questions, which is like by far our most popular call. But we also network, and we refer each other, and we collaborate, and we make sure our integrations, that's really being focused on quite a bit now, is making sure the data speaks to each other, so that that continuum of care is maintained. And that's super exciting to me because I'm a data nerd. So I really love that. It's going to help standardize the industry, and the fact that we're working on that even harder than we ever have is really exciting. So it's not just about networking, it's about literally helping the industry move forward. But we do have a lot of fun as well, and we all are like a really big family. So we welcome any vendors who want to be part of the group and part of the movement. And if you're a DSO, let us know, and we'll have you on our podcast, and we'll have you on our calls, and we'll send you a survey, all sorts of ways that we can collect the information from the DSOs that we need, so that we can meet them in the middle and bridge that gap.
Well, you do great work again. Thank you so much. Go to ds.com to learn more and participate. Join the movement that Eileen's been creating. Thank you again, and for what you do. Great service, and forward to talking to you again soon.
Thank you for having me on, Bryan.